Family therapy is critical in psychiatric care. When one person struggles, the entire family feels it. It's like a ripple effect. Understanding these dynamics is essential for effective treatment. For PMHNP exam prep, mastering family therapy concepts is a necessity. These questions will appear, and your knowledge here can boost your scores. The impact of family relationships on mental health cannot be overstated. Patients often present symptoms deeply intertwined with their family environment. Ignoring the family context is like fixing a leaky boat without looking at the hole. True healing involves addressing the system, not just the individual. As future PMHNPs, your ability to assess and intervene within a family system is powerful. This goes beyond understanding individual psychopathology. It involves seeing the bigger picture and fostering resilience within the entire unit. Hello everyone, I'm Dr. Drew Pinsky. Many of you might know me from my work in addiction medicine and relationship counseling. My career has been dedicated to understanding human behavior, mental health, and the role relationships play in our lives. I've seen how family dynamics can be a source of pain or a catalyst for healing. This experience solidified my belief in family-centered care. I'm passionate about helping future PMHNPs develop a strong foundation in family therapy. Understanding these principles will allow you to address the root causes of distress within the family context. At the heart of family therapy lies family systems theory. Instead of viewing an individual's problems in isolation, we see them as part of a larger system, the family. Think of a mobile hanging over a crib. If you touch one part, all the other parts move too. Families work similarly. The actions, emotions, and behaviors of one member affect everyone else. Another crucial concept is circular causality. In families, problems are maintained by a circular pattern of interactions. For example, a teenager withdraws, causing a parent to become more critical, leading the teenager to withdraw further. Identifying these cycles is key to effective intervention. Then there's homeostasis. Families strive to maintain balance even if it's dysfunctional. This drive for homeostasis can make change difficult. Understanding this resistance is vital for therapists. Grasping interconnectedness, circular causality, and homeostasis is the first step to applying any family therapy model. Structural family therapy, developed by Salvador Minichin, focuses on the family's organizational structure. Problems arise and are maintained by a dysfunctional family structure. Think of it like an architect looking at blueprints. If the foundation is weak, the house won't be stable. Similarly, if a family's structure is flawed, it will experience distress. Subsystems are smaller groupings within the family, like the spousal and parental subsystems. Each has specific functions and needs clear boundaries. Minichin would work to realign these subsystems, ensuring parents are in charge and children are allowed to be children. Boundaries define who is in a subsystem and how they interact. A structural therapist actively works to strengthen or loosen boundaries as needed. The goal is to create a more supportive and functional family environment. Strategic family therapy, with key figures like Jay Haley and Chloe Madanes, is about solving specific problems. Strategic therapists are present-focused and action-oriented. They believe problems are maintained by flawed interactional sequences. The therapist's job is to identify these sequences and design strategies to change them. Symptoms often serve a purpose within the family system. For example, a child's behavioral problems might distract parents from marital conflict. Interventions in strategic therapy are often paradoxical. For instance, a therapist might prescribe the symptom, telling a couple who argues constantly to schedule specific times to argue. This can make the arguing less spontaneous and potentially less rewarding. The therapist in this model is an expert who designs a plan to solve the presenting problem. The focus is always on change. It's an adaptable and creative approach aimed at producing tangible results quickly. Bowenian family therapy, developed by Murray Bowen, emphasizes intergenerational patterns and differentiation of self. Unresolved emotional issues are passed down from one generation to the next. The goal is to help individuals increase their differentiation. Differentiation means being able to think and act for oneself while maintaining emotional connection to the family. A key concept is differentiation of self. Individuals with low differentiation are more emotionally reactive and struggle to separate their thoughts from their feelings. Bowenian therapy aims to help family members move towards greater differentiation. Triangles are another central idea. When anxiety arises between two people, they often pull in a third person to diffuse the tension. The therapist helps families recognize and detriangulate these patterns. Let's consider a hypothetical case to see how these models might be applied. Imagine the Miller family parents John and Sarah, 15-year-old son Tom, and 12-year-old daughter Emily. Tom is the identified patient. His behavior has escalated, leading to frequent arguments between John and Sarah. A structural therapist would assess the family structure. They might observe that the parental subsystem is weak due to John and Sarah's conflicting approaches. The therapist would work to strengthen the parental hierarchy. A strategic therapist would focus on Tom's defiant behavior. They would explore the interactional sequences around his defiance. The therapist might design a directive to interrupt the old pattern. A Bowenian therapist would take a broader view. They might explore John and Sarah's families of origin to understand their learned patterns. The focus would be on each parent managing their own anxiety and improving their self-regulation. Preparing for the family therapy section of your PMHNP exam requires more than just memorizing names and terms. You need a deep understanding of the core concepts and how they apply. Create a solid foundation by understanding family systems theory. Concepts like circular causality, homeostasis, and interconnectedness are the bedrock. Next, tackle each major therapy model: structural, strategic, Bowenian, and others. Identify the founder, core principles, key concepts, therapist's role, and common techniques. Creating comparison charts can be helpful. Practice applying the theories to case vignettes. Many exam questions will present a clinical scenario and ask you to identify the most appropriate approach. Consider forming a study group to discuss cases and quiz each other. Review the material regularly. Use flashcards for key terms and concepts. The more ways you engage with the material, the better it will stick. As you approach your PMHNP exam, it's natural to feel a mix of anticipation and anxiety. But when it comes to family therapy, feel confident. You've learned about the intricate dance of family systems and various therapy models. This knowledge is powerful. It's not just about passing a test, it's about acquiring tools that will make you an effective PMHNP. Understanding family dynamics is fundamental to understanding your patients. By mastering these techniques, you're equipping yourself to see the bigger picture and facilitate profound healing. The journey of learning doesn't end with the exam. The field of mental health is constantly evolving. Continue to read, attend workshops, seek supervision, and reflect on your clinical experiences. Approach your exam with confidence and a genuine understanding of these concepts. Your future patients are counting on your expertise and compassion.